Welcome to The Explainer. Today, we're diving into a fascinating therapy that suggests the key to unlocking chronic pain might not be in your body, but in your brain. It's all about rewiring pain, and we're going to break down exactly how it works. So, let's start with a question for anyone out there who's felt that deep frustration, the kind of pain that just won't go away no matter what you try. What if the root of that chronic pain isn't purely physical? What if the source isn't where you feel the hurt at all? We're talking about conditions like fibromyalgia, chronic back pain, and irritable bowel syndrome. And let's be clear, the pain is undeniably real. But a revolutionary idea, backed by solid clinical research, suggests that for a lot of people, the control center for this pain isn't in the body, it's in the brain. And that brings us to a very specific kind of therapy. Instead of treating the spot that hurts, it targets the brain's danger alarm system, a system that, for some of us, can get stuck in the on position. It's called Emotional Awareness and Expression Therapy, or EAET for short. And its core principle is pretty mind-blowing. The idea that our brain, when dealing with unprocessed emotions from stressful events, can actually generate very real physical pain as a kind of warning signal. And let's be absolutely 100% clear about this. This therapy is not saying the pain is imaginary. Your pain is real. The only thing that changes is where we look for the source of that signal. We're shifting the focus from the body's tissues to the brain's own circuits. You know, the research behind EATE shows this really clear chain reaction. It all starts with a stressful experience. Then the emotions connected to that event, like anger or fear, get pushed down or suppressed. This avoidance puts the brain's danger alarm on high alert, and eventually that constant danger signal can actually show up as real physical pain. And the research gets even more specific, which is pretty cool. It identifies two main buckets of emotions we tend to push away. On one side, you've got anger and pride, which are all tied to our need for independence and control. And on the other, you have sadness and guilt, which are linked to our need for connection. The theory says that avoiding these powerful emotions from either side can keep that internal alarm system ringing. Okay, so if avoided emotions are setting off a faulty alarm in the brain, how exactly does this therapy go about fixing it? Well, it's basically a process of rewriting your own story. This quote from one of the therapy's developers, Dr. Howard Schubiner, just says it all. The point isn't to relive trauma, it's to change it. This is done through this amazing neurological process called memory reconsolidation. Just think of it like editing a document. You open up that old, painful memory, create a new experience with it, and then you save a new version right over the old one, completely changing its emotional power. This is all done through what the therapy calls a corrective emotional experience. So in the safe space of a therapy session, a person can finally access and express the feelings that were originally suppressed. And in doing that, they get to create a totally new, healthier outcome to that old story. And this process is just fascinating. First, you revisit the memory, but as your current, adult self. Then, you identify the core emotion that got buried. The third step is key. You express it. You give that anger or sadness a voice. And finally, you create a new outcome. And this is the magic part, right? This new outcome directly addresses those deep needs we saw earlier. By imagining standing up for yourself, you're meeting that need for agency. By imagining receiving care, you're meeting that need for connection. This new empowering ending is what tells the brain's alarm system that the danger is finally over. Now, this all sounds pretty compelling, right? But the big question is always the same. What does the science say? Is there any hard data to actually back this up? Well, the results are pretty remarkable. In one of the foundational studies, a full 2/3 of patients, that's 66%, saw a significant reduction in their symptoms. I mean, in a field where finding effective long-term relief is notoriously difficult, that is a huge number. So how does it stack up against the gold standard? A major trial funded by the NIH compared EAT directly to cognitive behavioral therapy, or CBT. Now, CBT is a common therapy that helps people change their thought patterns to better cope with pain. But look at the difference here. While CBT focuses on managing pain, EAT aims to resolve the underlying emotional conflict. And the result? EAT was found to be superior on several key measures. And its application is proving to be incredibly broad. Researchers are seeing promising results across a whole range of conditions that are often really difficult to treat. We're talking fibromyalgia, chronic back pain, IBS, and even chronic pelvic pain. So, after looking at the theory, the process, and the science, what's the most important thing we should all take away from this? What's the bottom line? At its heart, this therapy carries such a powerful and honestly an optimistic message. The path to physical relief often runs directly through our emotional world. When we give ourselves permission to safely process difficult emotions, we can turn off the brain's false alarms and, in doing so, find freedom from physical pain. And this really captures the spirit of the therapy. It's not about blame at all. It's the opposite. It is about empowerment, giving people a new understanding and a new set of tools to break free from that cycle of pain and reclaim their health. So we'll end on this final, thought-provoking question. In a world of high-tech medicine, it's a profound idea that one of the most powerful and effective treatments for real, physical pain might just be the courage to safely face our own feelings.